Academics absolutely enhances our work at CommonSpirit Health. If used smartly, it informs everything we do. It really kind of insists on excellence, and so you apply that excellence, that rigor, that quality to everything you do. Not just for the patients, it's for the learners, it's for everybody. Everyone is elevated when they're in that kind of environment because it encourages it, it enforces it, it insists on it.
Academics really enhances our work at CommonSpirit. The ability for us to train physicians and deliver health care, really anyone in our community that needs health care, it's part of our mission. And by training physicians in our culture who care about the community, who care about patients, who care about what's going to happen to them and their families, it gives us an opportunity really to train people in a culture that we feel is going to deliver the best health care for our community.
Academics enhances our work by bringing, cutting-edge ideas to the practice of medicine, whether it's evidence-based medicine, whether it's new techniques for procedures or approaches to patient care. Through academics at St. Joe's, we've been able to get new equipment in our ORs. We've been able to expand our simulation center for training of residents and faculty for that matter, and bring in new ideas for enhancing patient care.
Where there is academics, where providers, physicians, advanced practice providers, clinicians of all walks of life, nurses, when they're asked to teach, there is a halo effect that occurs across the entire organization. It raises dialogue, it raises discourse about medical care, and frankly, it raises quality. And so I think we have a tremendous opportunity, and we see it every day in places where we're training residents, fellows, medical students, that halo effect exists. And for us, it frankly adds joy and sustenance and substance to the work that we do every day.
As the single largest nonprofit health system in the country, it's appropriate and important that we play a role in sort of the continuum, and given the practitioner shortages and nursing shortages that we know are pervasive, I feel like it's all the more critical that we have an active role in that pipeline of educating the practitioners that we know we will so critically need in the immediate future and certainly in the long-term future.
The single most important thing we can do is embrace that we are a learning health system, and embrace that we are an academic health system, and harness all those positives that come with it.
We're going to, be the best health system that we can be. It has to be by best practice, and best practice is only achieved by sharing of data, figuring out how to improve systems through good data, and utilizing the proper analytics to make that happen. So all those are really components of academic practice.
In our facilities, we're on a high reliability journey, so it's not just about delivering the best quality, which we know residency programs deliver that, but how do we bring high reliability to everything else that we do? How do we interact with our nursing staff? And it's not just the doctors, it's the nurses, it's the people who work for environmental services, it's the folks who deliver food to the patients. Having that team that works together, that has a culture that they believe in to deliver best care, to break down power gradients amongst the different caregivers so that everybody's got ears and eyes open about what that patient needs.
I think the single most important action is to continue and accelerate the work that we're doing right now by collaborating, by asking the questions, determining what the problems are, and then with that collaboration, working on solving those problems.
I think it's a journey that we're on, and we have been on since the early days of CommonSpirit Health. It's an investment. It's an investment in leadership, in talent, in teachers from all walks of life, and in students and residents and fellows. And so to the extent we can hold those people out and sort of keep them with us in terms of mission and the care that we provide, we'll do just fine.
think academics, with regard to building our system, is just adding that one other piece. And the more that we strengthen that, it brings the latest in technology and innovation with new learners and what providers are going to expect in the future. So it really just solidifies that piece of our excellence and the way that we build systemness across CommonSpirit.
The secret of CommonSpirit Health is that we already have so much going on in the academic arena, whether it be research, UME, GME, or our strong partnerships with some of our academic institutions. And we just have to work on putting that all together, getting organized, getting coordinated, and putting that out there.
To be able to see the innovation, the creativity, the intellectual curiosity, the engagement, the excitement, the enthusiasm, and the energy surrounding academics has been not only heartening, but truly humbling. When I joined this ministry, not even 2 years ago, there wasn't a unit that focused on academics and faculty affairs. I have been so grateful and privileged to serve in this inaugural role, to really help shepherd and support our work in this space. I am so excited for what is to come. I believe that this is only the beginning of our journey.
So the first thought would be training or teaching. That's the bedrock of what we do in academic medicine, because we're always trying to make sure that the coming generations have the best practices based both on our experience and new knowledge.
The first three words that come to my mind when I hear the word academics, I would say first, excellence. Excellence because from the journey that I've experienced in academics and academic medicine, the strive for excellence universally and consistently is one of the most important unifying aspects of academics.
We have a tremendous opportunity across the scope and scale and impact of our organization to really redefine how we train the next clinician in a way that no other system has. And so the word I would choose is opportunity. I would choose redefine. Redefining the future clinician for the type of care that our patients truly seek and deserve. And the last word I would choose is bold. We have the opportunity to be bold in ways that maybe we might not immediately think about when it comes to academics. We can be bold, we can be innovative if we take advantage of those opportunities and we do redefine what academic medicine looks like.
So the first three words that come to my mind with regard to academics is in the context of the clinical learning environment, which is really what I'm focused on. And those three words would be curiosity, engagement, and psychological safety. And the reason is our medical students and residents are learning actively many aspects of medicine. And they have to be able to ask questions, feel safe to be able to make a mistake and learn from it. And how we engage them and teach them is also very important. And keeping them curious keeps them in that mode of being a continuous learner, which is really where we want physicians to land at.
I was a great learner, but when I joined Creighton, what I learned was how to be compassionate and caring. The Creighton values of cura personalis, taking care of the person as a whole, that's what shaped me to be who I am today. And I had incredible mentors at Creighton that are still my mentors, and I'm so blessed to have them.
I've been in academics over 4 decades. My career aspiration was to be a professor of medicine. I accomplished that over a decade ago. And it reflects so much of my career at the present time. I think it's had some influence on my children as well, several of whom are in academics.
I grew up in academics. I actually only know academic environments. And when I first transitioned to leadership, it was in academic leadership roles. So I really think that has shaped how I look at things and the lens in which I sort of pursue things and do things, because I think it just so informs the decisions you make. So there's no decision I make that doesn't have some component of that academic lens when I make that decision. Can I integrate it? Can I overlay it? Maybe not, but can at least influence good, smart decisions and strategic decisions I make.
Being in environments that challenge us to think beyond what we believe is possible, being in a community of peers where we have the opportunity to contribute to the strength and the quality of the community through intellect, through exchange of ideas, through interactions, dialogues, and thought that drives change. All of that is academics, and I have been privileged and grateful to have academics as the underlying foundational and continual thread throughout my entire professional career.
When I think about academics, it's not a static process, it's an ongoing, continuous learning environment, and what may have been relevant in years past, we have learned that that's no longer relevant. And so academics reminds me of a continuous renewal and a continuous learning that allows for growth within medicine, growth within communities, and also that provides in-depth knowledge, new knowledge for learners.
What we are about as an institution has always been about providing the opportunities for learners, for people to participate in the environments that have been created by those who came before them, to really structure experiences that will create, I think, for them the opportunity to contribute. And I think that's the real piece of it. But in all of this, it requires commitment, right? It requires commitment both of the learner, but also, I think, a special commitment of that teacher, that mentor, that faculty. Right? In order to ensure that those contributions are met. I think those are the things that come really to mind when I think about the importance of academics, especially in medicine.